Alcohol is one of the oldest known anesthetics. There is considerable overlap in studying the mechanisms of alcohol and our modern anesthetic agents. A patient's alcohol use history, including chronic alcoholism or acute intoxication, is a major consideration of how we manage their anesthetics. What's not known, however, is whether an alcohol intolerance has any impact on the mechanisms, sensitivity, and recovery from general anesthesia. A common genetic variant that leads to alcohol intolerance is a point mutation of mitochondrial aldehyde dehydrogenase 2 that reduces ALDH2 activity. This variant is found in over 500 million of the world's population, most commonly found in those of East Asian descent. The enzymatic activity of ALDH2 removes toxic aldehydes from the cell, perhaps most notable for its removal of acetaldehyde, an intermediate of alcohol metabolism. Interestingly, volatile acetaldehyde is itself a general anesthetic. Through the generous support of the Foundation for Anesthesia Education and Research Mentored Research Training Grant, I aim to discover whether alcohol intolerance in a mouse model of the ALDH2 variant impacts its sensitivity and recovery from general anesthesia. I believe that the metabolic consequences of decreased ALDH2 activity in the brain impacts the arousal from anesthesia, and we've already shown that there's delayed recovery from anesthesia in this mouse model. Ultimately, I plan to translate these findings clinically and observe potential differences in the post-anesthetic recovery between patients with and without the ALDH2 variant, providing evidence for precision anesthetic in patients that are intolerant of alcohol.